I always tell people there's nothing unscientific about this field. First of all, the diagnoses of these conditions, discernments, are very rigorous. Certainly the Catholic Church has a venerable manual called the Roman Ritual for helping people discern these cases, and it requires what's called moral certainty. In other words, the exorcist is not supposed to just sort of spiritually intuit that a case is involved. They really are supposed to require clear evidence of a foreign entity, such as that the seeming entity who often speaks out of the body of an individual exhibits not only hatred of everything sacred, but shows what's called hidden knowledge. In Latin, it's called latra, of matters that they otherwise would never know, and/or as other of these demonic signs, like speaking foreign languages and having very abnormal strength or movement, like a levitation. When psychiatric colleagues question me about how I differentiate that from mental illness, I say, look, I mean, I've evaluated probably 27,000 psychiatric cases in my life. None of those people have I thought were possessed. None of those 27,000. These are people who are sent to me as patients. But these other cases that are sent to me with people suspecting there might be something more to it, about them, I say to my professional colleagues, I say, look, how many patients do you know who all of a sudden know all kinds of hidden facts about your life, can speak foreign languages, including perfect Latin, and have reportedly, to me at least credibly, of either experiencing or as witnesses observing something like a levitation. I mean, you need this very strong evidence, and that's the evidence that I've seen in many, many cases, Josh.
Yeah, absolutely. And I'm glad that you mentioned that you were a very highly regarded clinical psychiatrist, and had a career. You have a career on top of this particular ministry, I suppose. I guess I would consider it a ministry. You have a professional psychiatry practice, and that means that there's who better to be able to evaluate any differences between the run-of-the-mill mental illnesses and these more extraordinary examples. And that kind of leads me on to my first curiosity, and I think it would be helpful to do this for our listeners as well. So can we differentiate a little between mental illness in the traditional sense, and then perhaps some other varieties of spiritual attack that people may face as beyond the regular mental illness? So would you mind giving us just some definitions and maybe talk through a little bit of what you would look for as you're trying to categorize a particular patient?
Well, even though many experienced exorcists are very capable of discerning demonic attacks, even without medical input has always been suggested, and that's nothing new. People sometimes think in centuries past people were overly superstitious. Actually, most medieval doctors, for instance, did believe in mental illness as a separate category, often with biological elements. So it really helps in tricky cases to be able to know both fields, to know the field of medical problems and psychiatric problems, and also to know the criteria for the different types of demonic attack. So in the modern world, when we have a little better diagnostic tools, for instance, there's no question that certain types of neurological disorders like Tourette's disorder or epilepsy were sometimes misinterpreted in the past as demonic. But in today's world, we can diagnose those pretty well with EEGs and CAT scans and MRIs and stuff. So the conditions that are, the disorders that are most confusing to modern people, including some doctors, is when the person, say, is psychotic and they imagine or have delusions and hallucinations about evil spirits. When the person has what's called different types of dissociative disorder, used to be called multiple personality, where there'll be a more malevolent personality, or people who are very easily, misled or histrionic or suggestible, where somehow because of their inner feelings and maybe feelings of destructiveness or even outright evil, people jump to the conclusion, especially in fundamentalist communities, that they are possessed or something. I mean, I don't normally think, I've run into a lot of sociopaths in my life, psychopaths, and by and large, they're evil people. They're not necessarily possessed. So you have to be able to rule out these medical disorders when it's tricky. And then at the same time, you need to see these very rigorous criteria. Now, not all demonic attacks are possessions. Possessions are sort of the ultimate takeover of the will and the consciousness of an individual. I mean, it's an invasion of the body, and they will be using the body, and they will be even using the vocal cords of the individual. But there is those clear criteria that I just mentioned that you will invariably see to be able to diagnose a possession. And then there are cases short of that where people may be experiencing some other odd symptoms. They're often a little harder to diagnose, and this is where medical expertise often comes in. For instance, the first case that Father Jacques brought to me, she had come from about 2,000 miles away, and she was a woman who claimed, as it turned out very credibly, and I even spoke to friends of ours and her husband, claimed very credibly that she was being beaten up by evil spirits. And she had bruises all over her body. So you can imagine, as a physician, I wanted to make sure she didn't have some kind of clotting disorder or blood disorders. Yeah, something like low platelets or something. So we did a workup. She was, we even sent her to a hematologist, and everybody was mystified. And I had to say to this exorcist, Father Jacques, who unfortunately is deceased, look, I mean, I can't diagnose this woman. She seems very sane and otherwise medically cleared. I can't diagnose her with a medical or psychiatric illness. And Father Jacques said to me, well, that's what we thought. We thought this was what was called an oppression. There are different types of oppression, and there are even different languages. For instance, every couple of years I go to Italy, and the International Association has its own terminology. But in the book, I write about what I call internal and external oppressions. External meaning a seeming attack by a invisible spirit. But you'll see the results, and some people will report being choked, scratched, bitten, even burned at times. And
so physical manifestation of that diabolical entity?
Yes, it's clearly, because again, we're ruling out all other possibilities. And then other people have what's called, what I call, not everybody using the same language, internal oppression, where their senses or their cognition is somewhat affected. For instance, I write about in the book another woman who was a housewife and her hearing was blocked, which is similar to a case in the gospel. In her case, though, the hearing was selectively blocked. So, for instance, if you said to her, I call her in the book using pseudonyms, although all the other facts in the case are accurate. If you would say to her, Catherine, which is the name I gave her in the book, Catherine, what did you do this morning? Mm-hmm. This woman was possessed, by the way. Mm-hmm. But this can happen in an oppression as well. But I said to her, which is why I'm presenting it as this internal attack on the senses in this case. Mm. I said, Catherine, what did you do this morning? And she said, well, I went to the supermarket. I bought some food for lunch. She was a good cook. And some of these individuals, outside of when the demons are manifesting themselves, can have somewhat of a normal life to a degree. But if you said to this woman, Catherine, did you pray today? Or Catherine, did you go to church? She would look at you and say, I can't hear you.
Wow.
So the point there was that the demons were blocking her hearing. Mm-hmm. So this psychiatric colleague of mine, we had this bright idea. Let's write it on a piece of paper, the question. So we wrote on a piece of paper 2 sets of questions. One was, Catherine, what were you working on this week? And she would say, well, I was getting the house cleaned, and I had to take the truck and go to the dump and stuff like that. And then we wrote on a piece of paper and held it in front of her like this. Mm-hmm. Catherine, are you trusting in our Lord, and are you able to pray today? And I still remember vividly, she looked at me in the face and said, with a sort of look of disappointment, she said, Dr. Gallagher, why are you showing me a blank piece of paper?